ELiTE stands for Essential Learning in Trauma and Extremities. ELiTE was designed to provide a standardized educational curriculum for residents and fellows throughout their entire learning journey.
When Sharon took the lead at Acumed, she approached me with the goal to have a discussion about generating an educational core or an educational focus.
So I first learned about the ELiTE program through Acumed's medical education team. We have 4 fellows per year. We also have a very large residency program, so they thought that we would be a great test site for the ELiTE program.
Education is the core for practice. The exciting part of this is to try and generate a curriculum that's going to be portable and easily duplicated and easily transported, but also very modular.
The ELiTE program allows us to take it to a higher level with cadaveric demonstrations, cadaveric dissections, and surgical procedures that are now covered by some of the more basic courses.
We designed the ELiTE courses in 3 different levels to ensure that we were developing an educational program that's dedicated to where that resident is in their current stage of their learning.
So as we looked at the ELiTE program working with medical education, Dr. Greenberg, we felt that it's really important to separate out to really 3 levels: basic, intermediate, and advanced, really based on the trainees' knowledge base and also skill level.
I think separating the courses into 3 different levels is one of the critical elements of this whole ELiTE program, especially when you have a cadaveric, practical, hands-on component.
As a faculty and also an educator, I think the one thing I would love them to take away from the ELiTE course is for a fellow resident to walk away feeling like they really had a comprehensive experience, that when they've completed the course, they feel really comfortable with the knowledge base and also fixation of complex hand, wrist, and elbow fractures.
I look at the educational curriculum that we've developed, another one of the building blocks that supplements the education that residents and fellows are getting at their current program.
We really wanted to design the educational program of ELiTE to be really focused on the hands-on component of learning.
The more repetition you have, the better you are. So goal is by the time residents graduate from their training program are also fellows that they're ready to treat patients. So the more experience we could really give them under their belt as part of their training, I think the better outcomes they'll have. Any cadaveric time is really valuable to their training.
So you're getting a concentrated exposure to high quality specimens that you might not have access to in your practice. The way we improve is by practicing. Some of the techniques and some of the things they're going to learn at both the didactic as well as the lab component are completely new. And practicing that on a cadaver is the first step.
We wanted to make sure that we reached out to educators from around the globe to ensure that we were leveraging a wide array of expertise and knowledge base and many, many years of experience in educating residents and fellows.
I think what also makes the ELiTE program unique is that in building the program, they really reached out to top academic centers in the country. You're looking at 10 to 15 programs that really contributed to this to really make it the best curriculum and really getting feedback from each faculty.
Every single person that's involved is recognized in the field. They're all experienced educators. They all have a significant interest in clinical education. And the goal there is to impart a variety of perspectives on treatment to the people that are taking part in these courses.
I think the most exciting part for program directors and also for residents is looking at the curriculum and realizing just really how comprehensive it is. The curriculum is really built around principles, understanding fracture principles, fixation, also surgical approaches rather than product driven. We don't want this to be another course, we want this to be the course that everybody looks at and just through word of mouth, like you have to go to this course.
We are so excited for the ELiTE program. We've spent a lot of time pulling this together and we can't wait to see everyone there and experience it for themselves.
Interacting with young surgeons and surgeons in training is one of the most gratifying experiences, and we all love doing that. To be part of that is exciting.